Hi. So tonight I will be talking about my third and most recent stay in the mental health unit. It just happened this year in March. Um, this time I was in a depressive episode since September of last year. Still no job. I was starting to have an uptick in seizures. So that meant that my seizure med wasn't working. We kept adjusting it, but it still wasn't working. Um, so I just got switched recently again. So I went to the local crisis center, and they the lady there that spoke to me was very, very nice. Um, and this is the first time I've ever walked into the crisis center. And I told her what was going on. I felt like how I felt and thoughts I was having. And this time it was scary for me because I'm used to having the thoughts of wanting to hurt myself. But this time around, I had actually hurt myself every single Wednesday leading up to this. So that was 3 Wednesdays in a row. And I also was having thoughts of wanting to hurt my dad. And that's what scared me the most, was having those thoughts for the very first time of wanting to hurt someone else. Because I still live with my parents, and I know where all the sharper objects are, and I'm always the last one to go to bed. So, and I was dissociating every day since February of this year. So it was just like I wanted to go to the hospital, and despite me being hesitant to go because of my mom having this thing called 3 strikes, meaning if I went again, I wouldn't be allowed back. Thankfully, that did not happen. I was allowed back because I'm living with them right now. So it's very frustrating having those thoughts and being down feeling down, and like it's not worth it for months, and then dissociating for a whole month. Well, it was almost 2 whole months at the time I was admitted, because I didn't go until after my birthday. And so the first couple of days I was totally out of it. I didn't know that they were changing my meds, like changing the dosages of my meds, let's put it that way. I didn't know that they did that until I got home and saw the discharge paperwork. Yeah, so that's one of the things that I learned, was to always pay attention to what they're asking you ask what they're giving you and what dosage, so you can question why. The only thing that I questioned was the lithium, because before I went into the hospital, I saw that it shouldn't be given to people with epilepsy, or it should be, caution should be taken if you have a history of seizures, taking it, and to let the doctor know. So I let them know, so they didn't up as much as they would have liked to, which was good. And that just got lowered by my outpatient psychiatric nurse practitioner because of the side effects I'm having. And she totally took me off of the Cymbalta, that level that I was put on when I was in the unit. One thing I really appreciated about this unit was it was lighthearted, and we had fun together, a lot of fun together. We joked. They looked at, like, all the patients were looking after me because I let them know that I had epilepsy and that I dissociated. So I wanted them to know so that they knew what to look out for. And this is where I learned that trick about that hand in the cup of ice to see if it's dissociation or not. And that was very helpful. It was also very helpful with the therapist. We actually had a therapist on this unit versus just a social worker. I know social workers can be therapists too, but it helped that this therapist acknowledged that he had been admitted to mental health units before, because a lot of therapists keep that to themselves. And I understand why, because they're supposed to focus on you as the patient. And he would joke with us and about different things. One of those things was, once we were all discharged, if he'd have to be admitted himself, and he said possibly. So he made us laugh, and then he came up with topics that were interesting, like neuroplasticity, which is one of the ones where groups that I just got up and left without realizing I was doing it until hours later, and I was became aware in my room on the unit, which my room was directly across from the nursing station, which I really appreciated and wanted because of my epilepsy. I also appreciated that one of the nurses was willing to be in my room the second night with a CPAP and watch me to make sure everything was okay after I told them my concerns about having the CPAP in the room and me being in the room by myself with, especially also with having epilepsy. So they did raise the bed rails. So if I ever needed to, I could press for the nurse to come to my room that way, instead of having to get up from my bed, which was nice too. But so, and they had to keep a better eye on me too because of my epilepsy. They had to make sure my meds weren't interacting with each other, and that the dosages were fine. That's why they took me off of the Lamictal totally, because I'm assuming they didn't see any of it in my blood work, and it was already at one of the lowest dosages for Lamictal for my seizures, because that's the medicine that wasn't working anymore. And that's just like the first time I was in a unit, and they totally took me off of my seizure med that I was on at the time because of the same reason. I've tried Prozac, Zoloft, Cymbalta, lithium, and there might have been one other one for antidepressants, but I'm not sure. And this unit also helped me find my current therapist. And they helped me find an outpatient psychiatrist, which I decided to just stay with the one I had before I went into the hospital this time. And they also did the step down with me, so I was discharged and I was home for a full day before I on April 1st went back for partial hospitalization. And then that was about a week, and then I was off for a complete day before I started the intensive outpatient. And then because of the seizures, I was discharged early from intensive outpatient. So, but I was only in those programs because I talked with somebody before I was discharged from the unit saying that I wanted to do the step down process. So this time I was discharged just before dinner time. So I got home around just before 6 p.m. Because we went to stop to get my dinner for on the way home. And which was Lito's Pizza, which is a local pizza place. And then as I had to eat that pretty quickly because I had a 6 p.m. therapy appointment with the one therapist I had before I went into the unit, into the hospital. And she discharged me that same night instead of waiting a week, which I didn't really appreciate, but that's beyond the point. So, yeah, I've had pretty different experiences all 3 times, obviously, and that's fine. This third time was at a different hospital than the first 2 times. The first 2 times were at the same hospital, so and this one was at a different one. So I would definitely recommend going to your local crisis center and seeing which hospital they recommend that you go to if you have a local crisis center. That's one thing I feel fortunate about, that we do have a county crisis line and crisis center. So, and I live somewhat close to the one where the place where you can just walk into it and talk to someone. That's it for tonight. I will see you tomorrow. Thanks. Bye.